Okay, so we're going to start with speakers. It is my pleasure to introduce to you this morning the Acting Commissioner of the Maine Department of Health and Human Services, Ricker Hamilton, who will provide opening remarks. Please welcome Commissioner Hamilton.
Good morning, everybody. I have notes. Have to balance it with the laptop. Hope everyone's doing fine today. Thank you, Marianne. Good morning, and thank you all for taking part in today's conference. I'm Ricker Hamilton, Acting Commissioner of the Department of Health and Human Services, and it's a pleasure to be here to see the turnout for today's conference, where we'll focus on such an important issue as improving the care of our young people who are struggling with substance use disorder. It is critical that we're going to confront Maine's opioid drug epidemic head-on. It's critical what we're doing today and setting a path forward to addressing this problem. We all witness the devastating impact this is having in our state, and in many cases we see this unfold in our own families and communities. More than one Mainer dies of a fatal overdose every day. We need to make sure individuals know there is help and that there's treatment available. This is especially true for our young Mainers. All too often our children are exposed to these dangerous substances before they become adults. I see it in our child welfare system. More than 60% of the children involved with child welfare and are there because of parental substance use as a risk factor. And every year we see more than 1,000 babies born drug affected. This is heartbreaking. We must take action. We must be proactive. About 90% of adults with substance use disorders report that they started using substances before the end of high school. Nationally, there are about 1.8 million adolescents who are struggling with substance use disorder. What is even more troubling is only 1 in 10 will receive any form of treatment. 1 in 10. It gets worse. Those who do get treatment aren't always receiving high quality and effective care. We need to change, and together we will. As a parent, I could not imagine having to watch my son Sam take on such a battle. Any parent agrees we want our children to do well, be happy, live happy lives, and to be successful. That's what we all want. That's what we all strive for. In my role, I see the impacts of drugs, unfortunately, every day. How too often it keeps our youth from achieving those goals we want for them, we want for our own families, we want for ourselves. Alcohol and drug use brings along a host of serious consequences, such as trouble in school, family conflict, mental health issues, and sometimes, yes, even legal issues. A sad truth about where we are today is nearly everyone we meet is somehow impacted by a family member or loved one struggling with substance use disorder. I challenge you today just to look at a partner, look at someone you're sitting with at a table or in a breakout session. I guarantee you one of us is going to be in that situation where it's a son, a daughter, a nephew. It's very close, it's up close and personal. It's an issue we need to address. We need to work together, have differences, but then to move forward. That is what these victims are looking for us to do. At DHS, we have worked tirelessly to understand what practices will make the biggest impact and provide the best outcomes. We continue to evaluate and implement evidence-based treatment options such as medication-assisted treatment. I'm confident we are taking necessary steps and heading in the right direction. For youth specifically, we are focused on a number of effective treatments such as family treatment model, the cognitive behavioral therapy, and motivational therapy. We need to continue down this path, all of us working together. We will need to have a multidisciplinary approach as well. We know that 75% of heroin addictions start with opioid prescriptions. For years, these prescribed painkillers flooded our streets. It wasn't until it was too late that we saw the detrimental impact they would have and what they left in their wake. Now we must come together to take on this epidemic. Unfortunately, there's no singular, easy solution. And yes, there are disagreements about what is the best approach. Hopefully the collaboration that occurs here today will help facilitate some of the very partnerships necessary to make this effective change. It is crucial that we take a holistic approach in treating these young people. We must look at not only where they are now, but also how did they get here? How did they get there? How did they end up in trouble? One of the goals for today's conference is that you will leave here with a better understanding of how to identify symptoms and consequences of substance use disorders. A promising initiative that helped to bring together today's conference is the State Youth Treatment Implementation, which utilizes an evidence-based practice known as Adolescent Community Reinforcement Approach. This approach is a behavioral and cognitive behavioral approach that teaches youth and their families new skills to replace environmental settings and cues that have enabled their substance use. These are the programs that will usher in change, programs with new ideas and innovative solutions. We all want to help those battling with substance use disorder, to keep those from going down the same path, and to keep our families together. We can make this change by working side by side with a common goal in mind. Today's conference gives us that opportunity. We will hear from individuals who work and specialize in various areas of substance use treatment. I encourage everyone in attendance to take advantage of their expertise so that we are better able to evaluate our methods of treating young youth caught in the grips of addiction. We must make sure that these methods are effective and of a high quality. These kids are the future of Maine, and right now they are depending on us to help them out of this crisis. I am encouraged that there are so many of you willing to take time out of your busy schedules to learn and collaborate with your colleagues and peers in an effort to secure the safety and prosperity of our state's youth. It's critical. Today we can send them a message and let them know that we are here to support them. They are not facing this fight alone. None of us could go through this fight alone. You know that better than others. Thank you for allowing me to share some brief opening comments with you, and enjoy the day, and I look forward to collaborating and working with you in the future. Thank you all.